Assalamu alaikum, sabahkum Allah bil khair. A very good morning everyone and welcome to the third and last day of this conference. Today we are starting with our very own Dr. Rahman Al-Ghareeb, Director at Al-Ghareeb Medical Center, ENT, Sleep Medicine, Facial Aesthetic, and he's going to talk to us about sleep disorders. Ladies and gentlemen, please welcome Dr. Rahman Al-Ghareeb.
Sabah al-Khair, good morning everybody. It's my pleasure to be with you here. First of all, I don't do facial aesthetic anymore. This is always trouble to deal with the facial things, and we will get only the negative part of it. People not happy with their So, let's go for the presentation. Yes. Is it this one or? Which one is it? This one, yeah. Let us open this. That's it. I'm okay. Can I roll this, right? Yeah, I'll do this and that. Okay. Hello? I have to press here? Yeah, it's okay. So basically, my presentation is about sleep disorder and autism. I guess it is quite maybe new. People knows about this or talk about this, but I'm very much sure everybody with all experience, there is a huge link between autism and sleep disorder. Everybody suffers from that. Our kids, our adults autistic, our family caregiver, all of them, they are suffering from that. So let us speak about it. First of all, I'll speak in English. If you feel that you need something in Arabic, please raise your hand. I can give extra explanation for that to make things more easier. So, I want to start with this fact. 80%, remember, 80%, 80% of all autistic children, they have a sort of sleep disorder. Striking, huge. Just imagine, they have enough burden to have extra burden from the sleep. So, in normal population, it is 13%. Normal kids, they have 13% sleep disorder. Autistic children, they have 80. So let us start from here. So all the studies suggested, as we mentioned here, half, but it goes beyond that. Sleep issues can be a serious challenge for both autistic people and for the caregiver and for the community. Everyone, teacher, community, everywhere we have to struggle with children with autistic, first of all, but when we know that he got something behind it, which is sleep disorder, we have to struggle double. Many children with autistic spectrum experience sleep difficulties which affect their social interaction, behavior, learning, memory, regulations, cognitive feeling. We will come to explain this a little bit later on, why they have that. They are negatively impacted ASD symptoms. ASD children with a sleep problem showed more severe social skill deficit. They have some problem, and that reflected in their daily behavior. Score lower social test. ASD core symptoms affect sleep, for example, communication. This is the main problem, communication disorder, and we have to make sure that sleep disorder aggravate the whole things of core symptoms of the autistic person, which mean the communication skills. In addition to this, sleep difficulties can also take toll on their parents. It affects the caregiver in general. Child not asleep, mom is not asleep as well. Family not asleep as well. So we speak about who's going to do some kind of work this morning. She should attend work or he should attend. And it is going to be scale up this problem. So it's time to talk about it. Let us see, maybe we cannot give an answer, solution, but we can give a guideline how we can tackle this problem. So let us speak in general what we know about sleep. Sleep is approximately a third of our life we have to sleep, 8 hours a bed. So we have to take care of our bed because third of our life is there. It's dynamic balance. between existing drive to stay awake and pressure to sleep. There is two things, two force. Drive to sleep because you are tired, exhausting, because of the lot of things, factors, circadian, and then there is resistant or the awake cycle. So it is going like that. Regulation sleep awake is done by complex and set of interaction of hormones, of lot of things. But the two process control sleep is sleep awake homeostasis. We call it homeostasis. That's been sleep derived tendency to fall into sleep because you have accumulated lot of tiredness during the day, so you need to have that part of this. So your body asking for sleep, for homeostasis. But there is also internal clock. We know all human, all creature on the earth, they have something called circadian clock. Circadian clock, it is the internal clock in the body, regulate everything's eating, sleeping, thinking. So it's all regulated by this way of the cycle. This is internal cycle. So it is called the internal clock. So we have to know, and the internal clock, and with the sleep awake, sleep drive, that regulate the whole story of the sleep. We will talk about it a little bit more. In the morning, which with the sunlight, the body temperature being rise, cortisol, this is the hormone, increase, alertness cause wakefulness. So we are awake. In the evening, there is another hormone. It's called melatonin level is go up and start to feel drowsy and we feel to sleep. But it goes with certain rhythm. So this is the circadian process, as we said, but we have to know something. Two core characteristics of ASD symptomatology, namely alertness and sensory reactive and deficit and social interaction can affect photoperiodic and social input. Little bit difficult to understand, even for me. But in simple, we have to know autistic children, autistic person, they have some kind of sensory things that regulate in addition to what we have in the circadian. These sensory things play an important role in regulating the circadian. And then we have the social input, the habit, order, mindset, family, all these things, they affect the circadian of the children with autistic. So his sensory issue play a role, and the social interaction affect also the child. So these two things, which is not exist with me, for example, or with other people normally, normal children. So as we said, there is two, this is the hemostatic drive. We have is there any pointer here? Anyway, there is no pointer. So hemostatic sleep drive, this is the, you feel that you are tired enough, so you have to fall into sleep. And this is started with the sunlight. It is, you are fully awake here. You can see the arrow there. You are fully awake, and then it goes until you reach midnight, 9 p.m. Now you start, this is increase the drive to sleep. So by 9 o'clock, you have you communicate, what do you call, accumulated enough things to do the whole day. It makes you tired. So by that time, you are ready to go to sleep by 9 o'clock. And here comes the other factor, the circadian alertness signal, which we said the melatonin. It is increased by until reach maximum by 9 o'clock. So by 9, average 9, 8, 9, 10, our melatonin goes up level, and we are really very tired from the whole activity in the day, so we are ready to go to bed and so on. And we wake up in the morning and so on. So that is the cycle. So we come close to the point of why it is 80% of. So we have two cycles. There is rapid eye movement cycle, and there is non-rapid eye movement cycle. Rapid movement is referred to the dream stage. When you look at anybody sleeping, you can see his eye is moving like that, so he is dreaming now. And this is go cycle the whole night until we wake up in the morning. We just finish our latest dream. Non-rapid, it is the quiet sleep. There is some stages, stage 1, 2, 3, and this is the quiet sleep. Here is simply the muscle increase energy, restored tissue, repair, tear and wear. All this happen in this non-rapid eye movement. But rapid eye movement, it is the stage where the brain is working. We are dreaming. We are reconsolidate all information. كل معلوماتنا اللي في النهار تخزن في الليل. Only during sleep, everybody store his information which gain all the day. Same as here, we have on the desktop all information here, but when it's shut off, goes to the hard disk later on. So this is the stage of how information regulated, how memory works. Yeah, so this is during the sleep stage, REM stage, which is, we call it, what do you call it? I'm sorry, a dream stage. Typically, we have this cycle from rapid and until dream. It is 90 minute. So if anybody wake for any reason after 80 minute, so this is considered as a loss. So he should start from very much again. So if anybody interrupted your sleep, either you are normal person or autistic child or person, you lost that volume of that amount of sleep. Consider as none refresh. And everybody needs about 3 to 4 cycle every night. And then we can say, oh, I'm okay. But when you wake up morning tired, exhausted, non-refreshed, like I haven't have good sleep, it means you have some problem with those cycles, okay? So non-REM, characterized by reduction, physical activity, breathing hard, slow down, blood pressure drops, decreased muscle, relaxing, so difficult to wake up anybody when he is in that stage. And then the growth hormone start to work here, which is needed by everybody, including the autistic, by the way. Growth hormone needed by that increase the immunity, boost the body function and repair of the tissue and so on. That all happens in the REM sleep. When we go to non-REM, when we go to REM sleep, as we said, this is the dream occurs, breathing become more rapid, irregular, shallow, eye movement become very rapid, and dreams happens here. It renew. Now, this is the stage where we renew the mind and consolidate all the memory during the sleeping stage. If you don't dream, by the way, it means you have poor memory. Remember this. Who is not sleeping, not dreaming? There is a problem. So this is diagram about how it is wake and REM. So these are one cycle. It started from stage 1 here, and then go to the deep sleep, little bit stage 2 here, and then we go to the deeper sleep. So these stages, and we have % of this. REM sleep, usually, it goes in full cycle from here until the end of this, and then we wake up a little bit in the middle of the night. We just wake up, and then we go back to the sleep, and so on. That is going on the whole night. And we have, as we said, 3 to 4 portion of that good night sleep. Why we sleep, there is a lot of theories. Good sleep is optimal for mental health, for quality of life. Sleep loss and sleep disorder affect individuals' performance and safety. If you don't sleep well, you are not focusing, you are tired, you are exhausted, you have poor memory, you have poor work performance, you have poor relation with people, you have anxiety, you have depression, you have mental illness, you have, just name it, if you don't sleep well. That will affect your thing. Lack of sleep, of course, doze off on the wheel is major problem. People sleep on the wheel. Behavior problem, this is very important. Those who are not sleeping well, they have mood problem with their colleague in the work, everywhere. Now we are not focused on children with autism. These are normal people. They have these problems. Anybody who is not sleeping, they have this problem, definitely. Memory, concentration, learning problem. We have a lot of children, they are labeled as whatever you say it. They are ADHD or autistic or slow learner, or their problem is they are not sleeping. They are not sleep well for so many reasons. So fix their sleep, you will fix the problem from other side. Performance problem, decreased productivity, slower reaction. You cannot react if you are, there is something called micro nap. You are sitting here and that's it. To have a good accident. Micro nap, it happens because you have sleep deprivation. We have to understand this. Overeating, yeah, definitely. When you are not sleeping, you sit and watch whatever you have, WhatsApp, and your food intake is increased healthcare utilization. Yeah, if you don't sleep well, you have, for any reason, either mental health problem or physical health problem or cardiac problem, or hypertension or sudden death or stroke or this is increase your medical bill. Somebody should pay for that. So this is well known. That's why we said the corporates and the big companies, the economic impact of sleep is huge. So people nowadays, they think, yeah, we have to integrate sleep and corporate well-being program because this is affect the whole economy. This is away from our, okay. Important sleep for children. Now, we speak about children in general. Sleep is primary brain activity during early development. We can see all toddler, all newborn, they sleep up to 18 hours. More than 18 hours they sleep because they need that to develop their brain, they develop their memories. So, and growth hormone is works here, so that will change a lot of things. But when we continue in life, we have to think that we start by 12 to 18 hour. Toddler, they have a little bit less, and then we have a little bit less for the toddlers, and then we have preschool age, they need about 13 hours. Unfortunately, our kids, they have much less than that. That's why they are having some performance problem in their school. School age children, they need 10 to 11. And then when we come to teens, above teens, adults, we need from 7 to 9 hours. This is the standard. Yeah, but our children with autism, they don't have that hours. Never. That is very essential for normal living. That is the normal. Those with other problem, they don't have it. So that will be reflected and fire back on their performance. Logic, la? Sleep architecture and sleep in children with, there is something called sleep architecture, اللي هو الهيكلية السليب العامة. It should go like this. We start to sleep, some wave works here and there, so it goes with the sleep architecture. But we depends on certain few things we have to know. We have to fall into sleep after less than half an hour. When we go as per standard, we have to fall into sleep like that. If you stay awake longer than half an hour, then you have a problem. This is normal people. They have problem. If it is stay more than half an hour, just imagine autistic child stay for hours not sleeping. Mom with him as well. So, from polysomnography, sleep study, statistic, children with autism shows decreased quantity, total time in bed is decreased, and the REM sleep latency, it means how long he fall into dream stage, how long it takes him from the beginning until he fall into sleep. This called REM latency, it's all decreased. Increased proportion of stage 1. Stage 1 means even not deep sleep. It is superficial sleep. Stage 1, just now, if somebody make any kind of noise, any kind of sensory issues, he will be already wake up. So he's not started sleep. Children with ASD, they have longer sleep onset latency. They stay in bed long time. They struggle to sleep. They stay long time. Imagine they have other issues that will keep them also longer and longer. Reduce sleep efficiency. Sleep efficiency must be over 90% of your sleep. You enjoy sleep. It's not a matter of how many hours you are in bed. It's how many hours you enjoy the sleep. العبرة مو كم ساعة في الفراش، كم ساعة تهنيت بالنوم. This is what we are always focused on. Quality of sleep is the most important. Time is nothing. Yeah, wake after sleep onset. Yeah, usually you don't wake, only at the end of the REM cycle, but they are waking frequently. Keep waking whole night. This is very typical for autistic person. Why they have this? There is a lot of evidence shows that disturbance is very common. 50 to 80, as we said, half of children, as we said, it is above 80%. Normally for normal children, it is only 60%. They suffer from sleep disorder. Problem sleeping happen more often in the child, has restricted and repetitive behavior. If you have a child with a certain behavior, rocking, hand flapping, whatever thing, you have to expect even worse sleep problem for that child. If he's a little bit low function, different than high function as well. So these are a lot of details, but sleep problem, autistic people usually continue to the adulthood. Although when we become adult, it gets little bit gradually less and less and less. There is a lot of factor comes, a lot of experience, a lot of adaptation, a lot of things happens, make it little bit less than. So prevalence. Get في children with disorder spectrum, they have sleep problems such as insomnia, difficult to fall into sleep, is very high among autistic people. They cannot sleep. They stay in bed, يبقى عينه في السقف طول الليل. If there is some irritation there, light, noise, AC black, I don't know what happened, that will give him, if there is garden there and there is wind and noise of the tree, anything that can irritate him and break his sleep pattern. Autistic people with higher sensory hyperactivity and lower social skill are also having experienced more insomnia. There is a bidirectional relationship between autism and sleep disturbance. If you are autistic, you are more liable to have sleep disorder. If you have a sleep disorder, you have more liable to have behavior disorder. And this get in vicious cycle. حلقة مفرغة. Those with higher support needs also higher predisposition for sleep. What is that? I don't understand it. I don't know. Anyway, so we know a sleep issue doesn't disappear when we grow up. It is still there. Somehow it is getting more regulated than before. What is the impact? Sleep disturbance could negatively impact not only the quality of life and daytime functioning of child, but also family increase the stress level and parental sleep disruption. Child, even you take him to school, integration and wherever, he is not able to function well because there is very important things he misses over a long period. If we travel, for example, from here to United States or the very much Australia, we have something called disruption of normal sleep cycle. So we need at least 5-6 days to get adoption again to be normal, and we can have this, right? Everybody experienced that. Just imagine a person, he is not sleeping for months, years. So he has lack of sleep. Sleep deprivation is a chronic problem with autism. So we have to understand this very well. Again, 80% of autistic children, they have sleep problem. Please don't forget this number. There's association with more challenging behavior of autistic spectrum disorder children during the day and that affect their emotion, their focusing, their attention. They are feeling they are restless. They are getting showing also tantrum. That affect everything with child because he is not that that person who is really relaxed. There is extra problem on top of his basic problem. He is autistic, it's enough a big problem. But to put him in sleep deprivation, autistic, this is triple problem that they are suffer. These, our kids suffering from that. It increased nighttime awakening and decreased willingness to fall asleep, shown to be associated with poor appetite. Yes, we have children, they don't like to eat because they are not normal, they are not happy, they are not dream, they are not relaxed. They cannot shut off the brain when they go to bed. They cannot. The brain is still working. They are remember what happened today. I met this, I did that, I like that food, I don't like it. The brain is keep working. Usually now we switch off the brain and stay relaxed a little bit and we fall into sleep. That is normal. We have to train ourselves to do that. Those, they cannot shut off. It keeps on, keeps on. And if there is some events happen during the day, bad or good, or make him happy, or laughing in the night, in the sleep, or talking in the sleep, because he still remember what happened today. He met this and he laugh during sleep. You go there and say, what's going on with my boy? No, he is still awake. This is still continue to move on. So, increase nighttime awakening and decrease wellness, as we said, appetite, and that affect also the growth. We have children with obesity, or autistic children. We need to talk about it maybe in different, but obesity is also more common with autistic children. Increased aggression, hyperactivity, social difficulties that observed because of the sleep disturbance among autistic children could be indicate a poor mental health outcome. Yes, you don't expect him to be, whatever you do for him, psychological session, name it, all these speech therapies, I don't know, all these kind of rehab program, that will be affected. Because he had, we cannot say double, but maybe triple problem as he got. Short sleep duration is highly correlated with social impairment, especially ability to develop normal relation, peer relation. They have some problem. They cannot have, because they are not well rested. So they have so many things prevent them from having normal relation with their surroundings and their peers. Sleep-deprived children with autism tend to engage in repetitive behavior and compulsive ritual is more often. Don't have good night sleep, whatever he had, tantrum and all these things, it will be more. Because that will fire back after some time. Definitely. He cannot continue that, so he will be collapsed at one stage. So we have to expect this is because of lack of sleep again. They also have higher rate of behavior issues, depression, anxiety, paying attention at school and all rehab. They don't react as we expect. We said, come on, do it. They cannot. You cannot force them. Parents, caregiver, children tend to have more sleep problem. It is not his problem alone. But the whole family are suffering from that. We have to know this. Either mother or father or the whole family, they have to survive with that. Again, their brain is not shut off because they have to stay awake. Some children with little bit more aggressive behavior or more tantrum and so on, they keep walking the whole house all the night. They never settle down. All of us experience this in one stage or more. So what do you expect? The mom, she's going to rest and sleep? It's impossible. It is a problem. This problem will reflect in her career, in his career, in his work. Working condition will be affected. She had bad relation with her husband if he's not paying attention to her. She will have also bad problem in her job because her supervisor is not accepting she is coming a little bit late. She didn't sleep, as simple as that. But who is going to understand this? That is the problem. We have to focus and highlight how we can teach the community about this problem. This is overall for everybody. Parents, caregivers sleep less overall, have worse sleep quality, wake up earlier than other parents. They cannot sleep, as simple as that. They never have a full sleep cycle. They never. Talking about ladies, they have enough problem with the sleep as a lady because of the hormones. Because menstruation increase this and they cannot sleep. Getting pregnant, they have and then they cannot sleep. Getting birth and menopause, they have also increased, and that is flushing, and all this happens. And getting a baby with autism, wow. Causes of sleep disorder in children. It's thought sleep problems are prominent feature of ASD. The causes is not fully understood. Nobody can talk. Maybe high verbal or high functioning autism, they can tell about their experience because they lived with this problem and they know how it is. That is, but still a lot of talks about nobody give a full answer why we have sleep problem, but it is there. The etiologies are multifactorial, occurring secondary to complex interaction among biological, etc., etc. It's maybe possible due to genetic, circadian disruption, because there is some sensory issues. We have to focus on this. And this is the key for rehabilitation, for a training program, for we have to call it sleep hygiene program. We will talk about it later on. برنامج التدريب والتأهيل حق الأطفال عندهم توحد، كيف نأهلهم حق يعرفون يتأقلمون مع هذه المشكلة. Sensory issue, you have to switch it off as much as possible for those people with autism. Impaired social skills, yes, definitely. They have difficulty reading social cues. They cannot. We are sitting together. I am yawning, so it means, yalla, 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 baba, go out. I have to go to bed. This is a message. Everybody knows it. If I say something or I do something. But he is not understand this message. He doesn't understand it. So he keep running his way of thinking. So they have difficulties with that. So this is general speaking now. They have definitely problem. Now, come on. Still we have a long list to read and to talk about it. They are normal people. They are having all kind of problem health-wise. They can have sleep apnea. They are obese. They have adenoid. They have tonsil. They have, name it, that can stop breathing, and they have sleep apnea. They cannot sleep as well because of suffocation and low oxygen concentration. They can have, it's very, very common, they have restless leg syndrome. They feel something like crippling in their foot, on the hand, so something sensory that make them crazy, because this is a huge problem, especially for people with either mental health or autism. They have seizures disorder. They have regurgitation from food. They're choking, they're coughing in the night because they have obsessive compulsive disorder, attention deficits. There is overlap. Put autism here, ADHD here, you have a lot of common things in between. It's only we have to find out the relation between both, and we have to understand it. Anxiety, depression, reduced medication, because if they have to take some medication in certain stage, that will affect their sleep definitely. So we have to know these factors. Sometimes we cannot avoid it, but understand it in a proper way. It will help us to tailor our approach to this child. How we can do, what can we do? Even a simple small things can affect. So cause of sleep, behavior skill, as we said, core behavior, neurobehavioral features may contribute for sleep disorder, emotional dysregulation, fixation on daytime event. They cannot let it go. They are fixing to certain things happens to them. They keep repeat those bad things. They cry without any notice. They laugh without any notice because they keep, their brain is not let it go. Yalla, خلي تمشي, خلنا نروح. He cannot do that. That is working during the day, every single minute he got suffer from that. During sleep, it become very more obvious. Attachment to a ritual that don't facilitate sleep, because they have some rituals. They have their own routine. So go to bed, it's not something like that. You cannot tell him, go to bed, time to go to bed. No, it's impossible. So he got some ritual. So we have to understand and create a ritual for that boy, so that will facilitate. We'll come to this point later on. So environmental factors, home, sleep environment, sounds, sirens, traffic, garden, trees, even the switch light here, goes to red when the AC condition, that disturb him. He keep looking at that thing. So we have to know. The setup of bedroom in general is very, very much important for sleep. But the setup of bedroom for autistic child, it should be considered very, very important factor. Only you as a mom or as a father or as a family, you will understand what kind of setup will be, which color I have to put, which things I have to do, etc., etc. So it is self-learning. Nobody can give you a recipe for that. I know a lot of you, give me a recipe, what can I do? Sorry, no recipe. This is life we have to go all through. Caregiver may struggle to establish norm and create environment that is conduct sleep, especially if they have another children. Again, we have to think about the other people in the home, his brother, his sister, his mother. So how can they? So then we have to learn as a family how we can, for example, bring breastfeeding lady. She should wake up with the baby when he cry to give him milk, to feed him. But she should manage that wake up with the baby. So when he sleep, she go to sleep instantly, quickly, and then get a little bit small cycle of sleep. So that things you have to learn as a mom and as a family. And remember, we have this child, he is taking the whole focus of the family, but we have other kids. They have to live normally. So we have to know this. We have to learn how to match things. But all of them, they don't sleep. They have problem, the whole family. Many sleep problem naturally goes away when we grow up, include terror, nightmare, sleepwalk, a lot of parasomnias, a lot of things child happen just because this is still ongoing. So he wake up with the terror, we go to bed, we do something. There is something, they call some parasomnia. He go, open the fridge, eat something. There is a lot of things. So these are science. This is called parasomnia, and they are more likely to have it. Thought adults with ADS is significantly fewer sleep problem, but still they have this kind of problem even in the later on. Adults with ASD have higher rate of psychiatric disorder. Now with adult with a sleep disorder in children, it goes up until adulthood. It's getting less, but they have again another problem. They have diabetes maybe, they have aging problem, they have social interaction, they have anxiety, rejected from society, etc., etc. So they develop another problem. So everybody, they suffer from in all ages anyway. So what is symptoms of sleep disorder and autistic spectrum disorder? Bedtime resistant. They are not like normal. They don't go to bed as you give order. Go to bed now. Switch off. Sakit television. Mafi. Go sleep. It's not going like that. You cannot make your child go to bed because you are giving him order. So there is resistance. Difficulty initiate sleep. You send him to room, close the light, close the door. He cannot sleep. He will stay awake all the time. And they have difficulty to staying asleep, sleep is interrupted, early waking up, and subsequent daytime fatigue. Yeah. Physically, he is not enjoying, not only mentally. He is tired. As remember REM and non-REM, REM is regenerate the brain and memory and all these things, and non-REM regenerate the body, the function because of the growth hormone, because of a lot of things. So tear and wear process in the body and the brain happens only during sleep. So that child is suffer from, again, tired, exhaustion, beside what he is already have mentally and behaviorally and anxiety, depression, all these things happen. Common sleep disorder, as we mentioned, insomnia, difficult to fall into sleep, difficult to maintain good sleep, and wake up very early. If this happens 3 times a week for 3 months, this is called chronic insomnia. Now, a child with this, having that so many years, he got a very, very, very chronic problem. Simply, he needs help. Parasomnia, as we said, terror, walking, talking, etc. It all happens. Sleep disorder, simply parasomnia increase here because he is not shutting off the brain. It's staying, it's working. He cannot let it go, as we said. Sleep disorder, breathing, as we said, difficulty, blocked nose, allergy, I don't know, whatever, sinuses, big adenoid, big sinuses, big tonsil. All this give him difficulty to breathe. Sleep related to movement, as we said, restless leg syndrome, crippling in the... Then daytime sleepiness. A lot of children with autism, maybe they fall asleep just napping without any notice. That can happen to them. How to approach sleep problem in people with autism? This is the $1 million question. So this is, we have to know an early and routine assessment of sleep children could helpful for the child and for the parents. Now, let us speak very honestly. Is our health system capable to develop a screening program for autism and their sleep? I am a doctor as well. I work everywhere. I don't think so. We don't have. Put in mind that sleep disorder in autism, it has a very clear guideline. We cannot just say in this doctor or GP or primary care without any background. By the way, in the medical school, they never, till today, they don't teach sleep. Yeah, unfortunately. It's a new curriculum, a new science. 20 years back, it just started. But there is no real program for medical school doctors of the future to know about sleep. In general, not to mention sleep disorder and special need or an autism spectrum. They don't have any idea. What they have passion. They want to help. They think they deal with him as an adult or as a normal child. Take this, tell him this, put routine, don't give him food late, don't do that. Something general. But, sorry, it's time to have a guideline for that, for medical practitioner and health authority. They have to put guideline for that and help and educate our health giver to know how to manage this and create a really screen program for that. Sleep may be assessed utilizing subject and objective measures. There is a lot of measures can be measured. Those who are interested, who are willing to know, there is a lot of things. We are not inventing the wheel, although this is quite a new subject, but there is something we have to, there is a questionnaire in general, but we have to know something. We have to focus. Subjective measures include parental questionnaire, caregiver, teachers, all of them we have to design a very simple question, just very simple. Don't get people bored of that. Very simple question, put it there, ask the caregiver, they will help. They will answer, and you are able to analyze these things because you are now trained to be a sleep medicine doctor and sleep medicine doctor for special need. It's another sub specialty. So this is a huge science behind it. Psychological assessment, detailed history from parents, teachers, as we said, caregiver, describe the children's current sleep problem and obtain. So we have to ask a lot of things. A lot of people, they said, let us put camera in his room and watch him, what's he doing. He will focus, he will look at it. Another sensory issue. So how to approach sleep problem, people with autism, history, as we said, doctors usually ask autistic individual on their caregiver question. So we have to develop a standard questionnaire, and the caregiver, medical caregiver or health caregiver, they should know about this certain question. There is a sleep history which should include, this is very important, predisposing factor. Now, if we have any factor comes just newly, he got, for example, now, he is a teenager. He got now different hormonal levels and different things. So there is a new things came there. So we have to understand now, بعد البلوغ, this or that, they will have their problem. So there is something you have to predispose. You know it's coming. So you should change your way of thinking. You cannot deal with boy 10 years as boy with 13 years old. There is other factors came. So you have to expect predisposed factors. There is precipitating factors like onset of medical condition or medication or poor sleep hygiene. There is a lot of maybe mothers, they know Risperdal, I think, or don't know what other medication for mental health and for depression. When you give new medication, you have to expect another level of response of the child will be different because there is another things participating now. I cannot spell that. Preputating factors, yes? Like napping during the day, co-sleep, and parenting behavior. Now, the child is get used to sleep with mom in bed. So this is factor. We have to learn him and teach him how to go in his room and how we can deal with this habit. How can I push him away from my bed? This is another factor we have to think. So maintain deep, long. We have to keep diary. We have to write. We have to write. He wake up, he go to bed this time, he wake up this time. In the night, I heard him shouting or laughing. Keep diary. Then you will see the rhythm after some time. After 1, 2, 3 months, you will see that behavior is repeated. So now it is easy to talk to somebody with experience or yourself, tailor a program to, because you know now what's going on. But keeping just guessing, it's not good. We have to work a little bit more scientific. Yeah, there is a lot of sleep test, actigraphy, sleep study, some gadget you put it. But remember, these things can cause sensory things. They cannot let him go to bed even more. So, difficult. Management. Implementation of non-pharmacological behavior measures, such as bedtime routine, bedtime routine, bedtime routine, bedtime routine is the very, very, very essential here. Learn him, let him know this is time to go to bed and this is the time to wake up all the days. Weekend, summer, winter. First, establish this bedtime routine. You should find out how is circadian clock work with your child. You have to find out. My child, he will go to bed only after blah, 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 blah. Okay? So you know now. It is different than you go to expert and ask him, what can I do? He might give you just general answer. But you are the one who is going to find out what is the bedtime routine. And sleep promoting habits preferred first line of treatment. This is always stress everywhere. This is the first line. Once you answer that, bingo. This is the right way of dealing with. So, evaluation of bedtime routine, we have to analyze that bedtime routine. Do I have some kind of card showing him that at this time, with the sunset, with the sunlight, after dinner, you go brush your teeth, you go wash your face, you go, pee, do this and that, and then you go to bed, cover with a blanket. You should put the schedule. Let him do by his own, and you find out what is to improve here and there. Resistance is always there, but we have to find out. We have to find out. There is no other option. Nobody going to help, by the way. Only the mom and the family. Keep daily diary, as we said, identify factors affecting him. That kind of food gave him coughing in the night, this kind of things. He got allergies, sneezing, I don't know what. Observe these things and please do right. Do right. Assessment of food, environmental allergies, this is very important. A lot of theories about food for autistic. I'm not here to evaluate these things. I'm not the right person to tell any idea, any opinion about that. I have no idea. I am ENT surgeon, but I have passion in sleep. That's it. And I have a child. Now he's a young man. He's very lovely. Muhammad, he is autistic as well. So we learn. We learn from him, and we keep learning. So parent-based sleep education, we need to. Now here's the trick. If we have the integration of sleep problem for autism disorder, integrated that in our social work, in our caregiver program, in our school, in our health, that make the awareness. Mom, she is just recently shocked with a baby with autism. She is not capable to do a lot of things alone. So let us have that kind of a group which discuss rather than سويت مع ولدك البارحة, what happened to him, what is this, this is personal, why not? Okay, but let us create a program. Let us do a working group, working on a program, education program for family with autism. Who's going to do that? Please. Only you. The family, they have to do that. This is the initiative. So we have to initiate and encourage such initiative in the community. Then the other people, the officials, they will understand, wow, now we are different. We are dealing with people that are very knowledgeable, they have much knowledge and so on. So we have to create a healthcare program for autism. We have to integrate this program for autism and so on. So it comes always from down. You are the main power, and you have to push toward rectify all these mixed things. So parents and so, okay. Management. As we said, there is no secret. As we said, there is something called a sleep hygiene program. Sleep hygiene program is tailored program. It's not something you have to do it all. You have to understand your boy, your girl, your, I don't know, sleep disorder, autism child, autistic child, he got this, and based on your diary, what you did, consultation with the expert, blah, 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 you will find out how you can go. And then you can tailor your sleep, what do you call it, program for sleep. Some people, they use weighted blanket vest. That give them that sensory feeling. My son, he liked me to come to him in the morning, or his mom, and give him that pressure hug. He liked that kind of pressure. It give him, release all this one. And he just, he wanted, before go to bed, he want that. So we thought weighted blanket may help. Yes, it helped him, but it give him a little bit more, hot. So we have to adjust the temperature. By the way, we have misperception about air condition. We have don't expose to light, don't expose to fan, or put AC on, put this on. You know what temperature we need to have a good night sleep? Who said? Yes? 18. 1.8. Yes, this is the optimum temperature for bedroom. You have to sleep, and because, by the way, there is a lot of people, they go to exercise evening. And this is not recommended for everybody, include the autistic, of course. Don't do sport afternoon, because that increases the core pressure, core temperature. Body temperature goes more, so he cannot, it needs 6 hours to get back to normal. 37, you need 35, 35, so you can go in bed well. So, yeah, put a blanket, but don't stay in very humid room. And that affects everybody, by the way. And you will learn. Yeah, and just adjust that temperature for your child this night. See how is he sleeping after a week. Does it disturb him or make him quiet? So we have to learn. Yeah, white noise machine. Why, this is lovely. But try to find the machine without blinking light, without this thing, because that will distract him the whole night. So switch off all these gadgets which make things worse. Make his sensory, he's very sensitive for any kind of sensory issue. Smell, noise, light, name it. That's all sensory things. So put him away from those sensory things. Aromatherapy, lavender, you can try it. Why not? A lot of things is nice. Yoga, breathing exercise, sport and exercise. It's ventilate all these people with autism. They are, they like my son. He loves to do sport every day. It's a Bible على قولتهم. It's Quran. Must do it. There is no way to go away from exercise. He know how to do it now, and he have lot of options of exercise, and he divide the days. Sunday he do this, Monday do that, Friday do this, and so on. Walk, swimming, name it. Medication, yes, there is medication. Over the counter, some country there is some over the counter, which is we are not agree with that. We have to consult always the concerned people, the psychiatrist or the neurologist or pediatric neurologist. They have to consult them about what to give and what not to give. But in general speaking, yes, melatonin in low dose and this one can help, but always better to find out a proper consultation. But if this consultation came from general doctor, might be not that much good, because he has no experience with the children with autism. But if it comes from expert guy, they can give you also another little bit supplement with that, or give you magnesium, I don't know, give some sedative, or I don't know what. But they have anxiety, they can give medication for that and control dose. So consultation, the right people, establishing a board who we can go to them and they can tell. This is quite important duty, and this is your mother. You have to make pressure on that. You have to ask for quality of service. I don't want to go to psychiatric doctor in general. No, I want specialized psychiatric doctor in special need. That is how it works, and they have their duty. Our doctor, they have to encourage to learn this kind of new field and so on. We have, definitely we have, but we need to increase awareness about this importance. So there is a list of medication. I'm not authorized to go through this, but I just put it in general to tell there is some, but who's going to prescribe it? The right doctor for that. Yeah, interventions such as, I just mentioned that, I'll go back. Yeah, limited evidence exists about this medication, but again, the right people, they can prescribe it. So tip for better sleeps, as per American Academy of Neurology, recommended sleep hygiene as a first line of therapy, managing sleep disorder in children with neurodevelopmental disorders such as autism. Yeah, two-part, sleep hygiene, sleep routine, go to bed in this time, wake up, but you cannot just ring a bell, go to bed. No. You have to make a very much ritual. Start at 3 hours maybe before. And make him happy. He will finish this, he will eat that, he will brush his teeth, he will play a little bit games, he will listen to music. I don't know what he put pajama on. I don't want white pajama, I want the red pajama. And this routine you have to respect. And then he will be convinced to go to bed as per routine. And then wake him up also in the right time. Some people recommend, because they have some problem during the daily, because he should wake up anyway, because we send him to Alia school now. He should go there at 8 o'clock. So he didn't sleep last night, but he should attend activities. So that makes a huge burden. So maybe we give him extra hours. Let him sleep. Let him miss even lunch. No need. As long as he is not make noise, mama come, let him sleep. So that is kind of compensation. Why not? We have good experience with that. But it doesn't mean that everybody should do it. Sleep hygiene include optimizing sleep environment, light, room, temperature, noise level. It's art. You have to invest in the bedroom of your child. Honestly, curtain, noise isolation, light isolation, name it. Anything, you have to invest. Anything make him happy and rest, Do it. But don't apply your guideline. You have guideline, you sit with telephone, WhatsApp, and answer, and put AC on, put AC off. I don't like the banca, I don't like AC. This is your regulation, but not his. So watch carefully and learn from that. Maintaining clear, constant sleep routine include putting on pajamas, brush teeth, reading before bed, following calm and structured bedtime routine, etc. Turn off electrons. By the way, a lot of children, they like to stay with mom in bed at the beginning. Then they struggle to give him away. So, okay, what shall he do? Push him away, he cannot sleep. Stay with him in bed is also not right, because we are moving, we are doing a lot of noise. Our bedroom is not the ideal room for him. There's a lot of things. So, yeah, go to his room. Sit with him in bed, in his bed, for a couple of weeks. Then put a chair near his bed for a couple of weeks. Make the chair 2 meters away for a couple of weeks. Put the chair near the door for a couple of weeks until he gets used. Mom is not with him in the room. So let us respect his way of thinking. Make things gradual to go with him. These are just general things. So create predictable transition for waking to sleep hour. We have to create this from morning until evening. We have to prepare him. You go now to this, you will have to go to Alia, you will do croaking, you will do this, you will come back then. Mr. XY, he will come to you to do music session, this one, but Baba, you have to remember. And then we have the visual things. All of things we have to create, okay? Yeah, we have to give always warning, Baba, time to bed. Hello, time to bed, let him go. And then, hi, time to bed. Hello, snoring, bye, sleep, and so on. This kind of ritual is very important for it. You prepare him. Nothing called shut off and go to bed. No. On the contrary, you harm him by this. Work with child, help them to fall asleep without caregiver in the room. As I just mentioned about the chair, how you can do the strategy of that. Consider certain products geared for people with a sensory issue, as we said. They have sensory. So you have to take care of light, noise, heavy, weight, blanket. Keep it dry until you reach the right things. Create bedtime ritual, as we establish positive pattern, provide reminder, creating visual bedtime, etc., etc. All these things take time consuming, but you are doing more than this, suffering every day with a lot. But establish a concept and follow it, your own concept, you will reach that, inshallah. Many children with autism have problems sleeping, which can be hard on the child and caregiver. There is another sleep issues. We have to find out these sleep issues. Okay, so we have to know, is he got other sleep disorder, sleep apnea, restless leg, GERD, irtijaع مريئي, etc. We have to find out these things. Allergy, cannot breathe well, sleep disturbance have an adverse effect on their social interaction, academic, definitely. These sleep issues tend to worsen behavior challenge. As you know, we have to know this. Implementation of non-pharmacological measures is quite important. We start with the sleep hygiene, routine bed, routine wake up. Only with persistent routine, our children will learn and will be more adapted to these things. These measures, along with limited regulated pharmacotherapy, as we said, consult the concern and the right people if you want to give him this or that medication. It doesn't mean that what fit for her or him, it will be okay for them. Everybody has tailored mind, tailored way, tailored things. So we have to respect this, differences. So there is no prescribed idea, doctor, hello, give me I cannot sleep, give me. It's not like that. Everybody has his own way, his own problem. Sleep assessment should be done, as we said, that should be included in all routine evaluation. A question about the sleep, whatever we start with, simple question, please introduce it in your evaluation, wherever you are doing the evaluation. We should know. If you have more knowledge about it, it will be great. Until we have one day, inshallah, those team who are very specialized. Because as we said, 80%, please don't forget this, 80% of our kids with sleep, with the autistic disorder, they suffer from sleep. And that creates a huge burden on what they already have. So please, please remember this. Integration of a sleep wellness program for the autism is prime essential things. And time start to, we have to implement this. I have nothing. Shukran. Yeah, if I can answer.